It's amazing to me how much the foundation has accomplished, especially now that we're getting even closer to slowing the progression of MPNs and even prevention and a cure.
The JAK2 mutation is one of the most common things that goes awry in all of our bone marrows. And so really understanding that is, of course, important to our patients with actual full-blown disease, but also to the broader population, all of us.
The unique and particularly important things about the MPN Research Foundation are that they are very focused on studying questions that are important to patients. So, the focus of what they decide to fund is very much driven by what are the questions that patients are asking.
This is an organization that brings all of those elements, which are highly important in making progress in this field together.
Organizations like the MPN Foundation and the Leukemia and Lymphoma Society, for that matter, fill an important gap. It takes an organization like the MPN Foundation to provide that hand on the tiller, I guess I'd call it, in order to create that guidance and create that long-term vision as well.
First and foremost, we are a research organization. That is the mission objective of the organization. But we don't believe that you can we don't believe that you can make phenomenal strides in research without also being a patient advocate.
I so appreciate the MPN Research Foundation for being laser focused on moving research forward.
It's sort of a big tent, in the sense that it is inclusive the clinicians, the scientists, the patients, the patient advocates, pharma. Everybody is brought into this tent.
As a board member and as a patient, I see not only the impact in the past, but I'm really excited about where we're going in the future.
I think that no organization in the world except MPN Foundation can gather international experts and drive some project at international levels.
We reached out to fibrosis researchers in other areas. So, for example, lung fibrosis, liver fibrosis. And the result was quite stunning because not only did we get good research ideas, we actually snagged some researchers who, really hadn't been thinking about the MPNs.
We moved on to interventional clinical trials, investigating the impact of an anti-inflammatory diet in myeloproliferative neoplasms. Without that funding, the trajectory of our work wouldn't have been possible.
MPN patients can suffer from difficult symptoms, and our group, when I was at Mayo, helped to develop the MPN Symptom Assessment Form to better understand that, be able to track it both at baseline and in the context of therapy. We were fortunate to receive additional support from the MPN Research Foundation along the way.
We have outreach to just about every pharmaceutical company, small and large, that works in and has research going on or a drug in clinical trials for MPNs. Right now, we're working on something called the Progression Network, which is a new concept, and they're very interested in this.
The fact that different patients have different mutations and then secondary mutations, and what's lacking today is treatment options. There's limited number of options to treat patients individually based on where they are in the course of their disease.
Part of our funding actually was used to identify the calreticulin mutation as being one of the contributors to myelofibrosis and to essential thrombocythemia.
I think the work that we fund really impacts patients in a very significant way.
But there's some gaps that need to be filled in order to be able to do effective clinical trials for disease progression.
We need to keep moving forward and fund research to be able to provide more targeted, more personalized treatments for where patients are in their journey.
So when I was diagnosed as a young woman, there was very little information out there. So my first resource that I went to was the MPN Research Foundation. A lot of information that I had never received from my own physician was actually out there.
I think that's the vision that Bob Rosen had initially. He had grand visions, actually, for the foundation, where Friends of ET Research, I created that to help my daughter. But Bob had much grander visions.
It's hard for people on the outside to really understand what she goes through because she doesn't look sick and she doesn't act sick.
We still have a lot of work to do. And I don't know of any foundation out there that has a greater presence than the MPN Research Foundation.
This is very critical times for us to really understand this, and we'll get there with the MPN Foundation.
Because after all, what we want is a cure.